Hello, everyone. My name is Carlos Torrado. I am currently serving as an editorial fellow for the Journal of Immunotherapy and Precision Oncology, or JIPO. And I also hold a fellowship position at the Department of Investigational Cancer Therapeutics at MD Anderson Cancer Center. It is a pleasure for me to introduce Dr. Jibran Ahmed, an assistant professor at the National Cancer Institute in Maryland and an expert in early drug development. So Dr. Ahmed is also a member of the editorial board for JIPO. He published an article on our journal titled Use of Immunoglobulin Replacement Therapy in Clinical Practice, a review, which we are excited to discuss today. So, Dr. Ahmed, thank you for being here. We are grateful for your time. So to start, could you please explain to the audience the therapeutic mechanisms of immunoglobulins?
Sure, absolutely. So, well, in terms of immunoglobulin replacement therapy, the main mechanism is that it provides the essential antibodies to patients who have congenital or acquired immunodeficiency disorders. And we believe that this reconstitution restores the humoral immune system, which compensates for the deficient or absent immunoglobulin production. Certainly, this has clinical implications such as prevention of recurrent infections and improvement in immune homeostasis, and of course, significantly reducing the morbidity and mortality in patients with primary or secondary immunodeficiencies. We believe that immunoglobulins also exert several immunomodulatory actions, such as cytokine regulation, actions via FC gamma receptors, complement inhibition, T cell modulation, and B cell regulation. There's also, it's also known that the immunoglobulins exert its effects by neutralizing pathogenic antibodies or immune complexes, which might mitigate their harmful effects in autoimmune or inflammatory disorders.
Well, thank you so much for that clear explanation. Now, could you share some of the most common clinical applications of immunoglobulin therapy?
Sure. Well, the purpose of this review article was to summarize the use of immunoglobulin replacement therapy in both primary and secondary immunodeficiency conditions. So our main focus of this paper was to provide an updated reference for the practicing clinical hematologist and oncologist. Thus, we reviewed updates on its use in conditions such as hematopoietic and solid tumor transplants, conditions such as multiple myeloma and chronic lymphocytic leukemia, etc. And we explored the evidence gaps in the use of immunoglobulins in the context of immunodeficiency, particularly now that we have several novel agents being used to treat these conditions. We also highlighted the use of immunoglobulins in managing adverse events that are associated with the use of immune checkpoint inhibitors, which, as you know, is frequently used in the clinic.
Thanks. This has been very insightful. Lastly, could you please share your thoughts on the future of immunoglobulin therapies? I mean, how do you envision the role in treating several diseases moving forward?
Yeah, thank you for that question. I think given that we have a variety of FDA-approved immunoglobulin products which are now available and are also summarized in this article, it enables the clinicians to tailor the treatments to the specific needs of their patients. So at the same time, well, in the context of cancer patients, there are several new treatments that have emerged in the last decade, which may produce secondary immunodeficiency states or toxicities, which necessitates the use of these immunoglobulins. Thus, I believe we need more research and informed approach, which can be with which we can safely integrate the use of immunoglobulin replacement in patient care plans.
Thank you once again, Dr. Ahmed. It's been a pleasure discussing your work. I would encourage everyone to read Dr. Ahmed's paper, which is available online at JIPO, in order to gain some deeper understanding of this topic. We truly appreciate your time today. Thank you so much.
Well, thank you for having me, and thank you for taking the time.